Okay, good morning everyone. Welcome to the first panel discussion at Politico's Healthcare Summit. My name is Mary Eccles. I'm one of the health reporters at Politico. And yeah, as you heard, this session is going to focus on health policy in the new European Parliament. So since the EU elections in June, we've seen a whole new group of faces join the Parliament, some of them here with me today. But we've also heard kind of concerns about health falling off the agenda when it comes to, cuts to the EU health budget. We've also seen a greater focus, I suppose, on things like security, competitiveness. And we've also, most interestingly perhaps, seen a kind of very controversial figure be selected by Commission President Ursula von der Leyen in the shape of Hungary's Oliver Várhelyi, who, if he's approved this week or potentially in the next 24 hours or so, will shape EU health policy alongside the Parliament and countries. So his appointment has drawn criticism from several lawmakers, again, including from some sitting next to me today. So we'll be diving into that shortly. Just a brief reminder to those of you in the audience that there will be a dedicated Q&A, so do start thinking of questions, and we'll come to you a little bit later. And additionally, for those of you watching online, I'd like to remind you all to talk about our summit on social media using our hashtag #PoliticoHealthcare. So yeah, I'll just introduce all of our MEPs. So here we have Catarina Martins, a Portuguese lawmaker from the Left Group, who is a member of the Sant committee in the Parliament and also is a long-standing MP in Portugal before that. Next to her, we have Stine Bosse, a Danish MEP from the centrist Renew Group, who serves as a vice chair of the Parliament's Public Health Sant committee. Next to her, we have Vytenis Andriukaitis, a Lithuanian MEP from the Socialists and Democrats group, a member of the Parliament's Sant committee, but who also served, as I'm sure you're all aware, as the EU Commissioner for Health under Jean-Claude Juncker. And then, last but not least, we have Tomislav Sokol, an MEP from the European People's Party in Croatia. He's a coordinator at the Sant committee and also worked recently as a rapporteur on many health-related files, most recently the European health data space. So welcome to you all. Thank you very much for joining today. I wanted to kick off the discussion. Yeah, I mean, it feels strange in a way to talk about the Commission when this is about the Parliament, but obviously, the fate of the next commissioner lies in your hands, essentially. And this is someone who's going to have a huge impact shaping EU health policy for the next 5 years. And it was you guys who grilled him, obviously, 2 weeks ago. I wondered maybe if I could start with you, MEP Bosse. Your group, Renew, has been very critical of Oliver Várhelyi's appointment, specifically because of Hungary's approach to vaccines during the pandemic. This was something that came up during his hearing. But also comments he made during the hearing about women, about reproductive health more generally. And I think perhaps as the centrist group, perhaps that's a good indicator of how things will go. So I wonder, do you see Renew, or where do you see Renew falling when it comes to his appointment in the next day or so? Do you foresee him making it through and becoming the next health commissioner?
That is a very good question. But let me put it like this. And I think, there are many reasons why we should get things going in Europe right now. So let me put it like this. I do think that Mr. Várhelyi actually did quite well on some of the more sort of substance-orientated areas of the questioning, whereas the more, you could say, value-based, but even so very, very important areas, for example, on women's reproductive rights, it was really not very good. And in the written answers, it was just all over again. So I do think that there are some heavy talks going on. And at the end of the day, I do hope that these talks will result in a design of the Commission where also Várhelyi, because if it's not Várhelyi, then it's somebody else, and then we can start all over again. So I do think that this is what we should try and aim at.
I wanted to come to you, MEP Martins. Obviously, you sit on the other side of the political spectrum to him. And I think it was actually you who asked that question that prompted probably one of the most interesting responses of the hearing when, you know, he was saying he's definitely an ally to women because he lives with some, which was an interesting response. I kind of wanted to I think the broader question was about reproductive rights in the hearing, and I think he kind of defended his position by saying that's not an EU competence, it's very much a national one. There have been some campaigns recently that have tried to make abortion more of a cross-border issue, so I'm just wondering, where would you or your group stand on that? Do you see that as an EU competence or a national one, or how would you kind of square that?
Okay, so thank you for the question. So yeah, that was quite a weird moment of that hearing, you know, listening to someone say that I'm an ally to women because I live with women. I'm sure, I'm sure everyone knows how wrong this answer is, how deeply wrong this answer is. But the issue of abortion is something that is already an European issue for so many reasons. The first of all is that abortion is healthcare. So if healthcare is something that the European Union talks about, it has to talk about abortion. Why should we talk about diabetes and not talk about abortion? It's healthcare, and it's women's healthcare. In Europe, we have a stand that we believe that men and women should be treated in equal circumstances. So if there's a healthcare treatment that is for women, and it's called abortion, then we need to talk about it in the European level. Then, of course, the European Parliament proved that you wanted abortion to be a fundamental right. So, of course, we cannot have a candidate to health in the Commission and not answer about something that the European Parliament believes it should be a fundamental right, the right to abortion. And then abortion is already a problem in our healthcare systems and cross-border. And Hungary is a very good example of it. Because although the law says that women in Hungary can have access to abortion, the law is so humiliating to women that they cross border to get an abortion. So it is already an issue of cross-border between healthcare systems. So I think, yeah, it needs to be tackled. It's not possible to have an health commissioner that doesn't understand these basic issues. I believe that's a problem. And I believe it's also a problem. Then, as you know, the left group is against this nomination, but it is also a political problem when the European Parliament makes a second round of questions, a written question, and it's not able to write abortion in the questions. And so maybe we could also discuss, and I'm going to end so I'm not too long, how the agreement that exists to the Commission is really making the hearings to be more of a masquerade than something can be taken seriously.
Obviously, talking about competence, EU competence, national competence, I feel like now's the time to bring in you, MEP Andriukaitis. I know this is like a big passion of yours, and you've spoken a lot about in the past about EU competence in health policy and potentially wanting to look again at the treaties, broaden it to see in terms of what the EU can do in terms of health policy. I'm just wondering, A, where would you draw the line on that? And also, when you're speaking with MEPs, people at the Commission about EU competence in health, how realistic do you think your goals are, and what kind of response do you get from people on this question?
First of all, let's start from one general, basic question. Human rights is not about competences. It's about European Union essence. It's about all of us. It's about the rule of law. It's about our Convention on Human Rights. It means that 27 member states should respect human rights. Of course, I know very well how many countries are dealing with human rights, starting from in Malta you can find constitutional situation because they have their national constitution where they have, you know, debates about do not allow abortion and so on. In Poland and in Hungary, and of course you know that some commissions also depend on cultural ties, and when we are speaking about Varheli, we know that it is about Hungary and so on. But generally speaking, I see now very important issues. When we are touching issues related to human rights, we need to understand the Commission is a guardian of the treaties, and human rights is a cornerstone, and Commission can act Of course, respecting constitutions, respecting all issues, but dealing with human rights in all 27 member states and being guardian of human rights. And it's for all commissioners is the same. We need to understand it. Second, speaking about competences, if we are touching questions about what does it mean European Health Union and competences which are enshrined in Lisbon Treaty. Of course, I see that in 2004, in 2008, it was one understanding. Now understanding is different one. Now you see that those limits which are enshrined in Lisbon Treaty, they create a lot of challenges. Pandemic shows very clearly example about limits. Also, it's strange understanding. Healthcare is national competence. What about shortages of medicines? What about vaccines, actions to vaccines? What about healthcare workforce shortages? What about rare diseases? What about possibilities to diagnose? What about 27 different markets in EU, speaking about access to have innovative treatment and so on? And we all are like mantra, limits, 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 limits. We need now to raise questions. Now it's time to debate about new approaches, because we see that if we need to help people on the ground, the main challenge is EU should do more helping people on the ground. And we can help every state, every country, every community to address issues, but we need to have some shared competences to help to solve problems with healthcare workforce shortages, with medicine shortages, with access to treatment, with diagnostics, with all. Now we are seeing absolutely necessary debates. How can we expand limits? How we overcome? Otherwise, we will see very slow progress. And I started in 2014. We established in 2017 European reference networks. Until now, it is good. We have those reference networks. But you see how many limits not allow us to use full potential of European reference networks, dealing with 32 million people suffering from rare diseases, 32 million in Europe. But we are trying at 2017, now 2024, and we still so slow in possibility to deliver treatment to those in needs. And we are speaking about limits.
MEP Sokol, I'd like to bring you in on that point around competence, but I'd also like to get your thoughts, obviously as someone who's like the veteran MEP here, the person who was in the Parliament during the last mandate too. One thing that I've noticed when I watch the Sant committee is that there's quite a lot of vaccine skepticism and language around that. And I just wondered, is this something that's changed in the past year or so since there's been this increase of more far-right MEPs, or has this been present for since COVID? I'm keen to get your thoughts on that too.
Okay, a lot of things have been mentioned. I would also like to refer to some of the things that have already been said. On the vaccination, I think, I was also in the COVID committee. I think if you are following what was going on there, I think what we see in Sant is much milder than what we had there. So there are different positions, and definitely there are some issues where Parliament is pretty divided. On the question of reproductive health, I mean, I don't think it's good to turn this into an ideological debate, onto an issue which is very divisive. So maybe Parliament has adopted some resolutions in the past, but it was divided then. It is divided now. If we had a vote on these resolutions now, with the new majority, probably the outcome would have been different. So it's not. I don't think it's good to try to turn one's ideological position into something which is unified, which is common to everybody. So I think that is very important. When we speak about cross-border healthcare and the reproductive health and abortion, so the European Court of Justice stated on many cases, in really many cases, I did my PhD at K11 on cross-border healthcare, so I know something about that. It's also written in the cross-border directive itself that the directive does not extend the scope of what is covered in the national healthcare system. In other words, you can get healthcare abroad only for those healthcare services which are already covered by your health insurance. So you cannot go broader than that. So cross-border healthcare does not cover healthcare if you want to get something which is not provided in your own healthcare system to go abroad. I mean, you can do it, but then you have to pay for it by yourself. So that is clear legally. I mean, there is no that is explicitly stated. The Court of Justice said this on multiple occasions. So it's a fact. It's not a question of opinion. It's a legal fact. On Varhey, I have no personal reason to like him, because I was the one who was in the discussion when he called MEPs idiots. I was the one who asked the question, and then he was the one who said what he said, right? So I definitely have no personal interest in supporting him. But I would say that he was very good. He was very good. He was very, from the EPP's position, definitely. He spoke about things which I think are crucial now, which we have not touched at all in the first 17 minutes of this discussion. That's the competitiveness. That's the question of strategic autonomy, on being less dependent on import of medicines from other parts of the world. The fact that we are lagging behind US, even China now is picking up pace. It's getting much faster than us. And I mean, these are the real problems. I think we should focus on that and not on ideological issues on which we will never find a common agreement. So I think this should be our point of view, and I think on these points of view, he was very good. And on what he said on competences, this is something that is also a fact. I cannot add or took anything from it. So on the competences in general, competences are pretty clear. So they are partly supportive competence. So in some cases, EU can only support national policies. In some other areas like medicines or cross-border healthcare or cross-border health threats, it can do more. And we've done more. What is crucial is not, I think, the question of legal competences in these concrete areas. Is the question of, to a large extent, of political will. So in these areas where we had a political will, common political will, where we had a consensus that EU can do more than individual member states, there we could find common policy. So I think that since on reproductive health it will be impossible to find an agreement between different member states, I think that we should definitely leave them with the autonomy to decide to regulate this according to their own values, constitutions, etc. On things where we had a political will, where we saw that we can do more, we've done it. So and COVID was really, I think, the most important catalyst. The other important catalyst was your beating cancer plan, which was also an initiative in the beginning from my political group, from the EPP, which is also something that we are very proud of. And this was very important because healthcare before 2019 was really a marginal topic here. And I think that's also something that we should remember. So it was a marginal topic, it was definitely not a focus, and then COVID, but also beating cancer plan really brought it to the limelight. Unfortunately, we are losing the momentum now. I think that what our most important role should be, our most important mission should be to fight to keep healthcare as one of the priorities of the EU. I said that in the first Sant meeting in the new term, that for instance, what they've done with the reduction of the budget definitely does not send a good message. I think that this is one thing that we can all unite on, to fight to keep healthcare as one of the priorities of the EU, especially in those areas where we can really do a lot. For instance, rare diseases. If there is one area where EU can provide an added value, it's rare diseases. I come from a small country. Colleague Andriukaitis also comes from a small country, other colleagues as well. So definitely for rare disease, we need common European policy. We need European reference networks. I think I agree. So it was a very big achievement on your part. I think we should strengthen them. We should provide them with enough funding. On cross-border healthcare issues, where it is clear that EU has competence, I think that we should find a way to give more information to the patients. Most patients do not know what their rights are, to simplify legal rules. So if you want to access cross-border healthcare, you need to be an EU law expert, health EU law expert, to actually know what your rights are. So I think that in these areas we can do a lot. In terms of funding, in terms of providing information, in terms of simplifying legal rules, in terms of providing the right to second opinion. Because in many cases, if you want to access healthcare abroad, you go to domestic health insurance, there's domestic experts, and they say, yes, but we have a very good treatment abroad.
We're just going to come to some of those issues in a minute, but I just wanted to interrupt for 1 minute. I think MEP Bosse wanted to respond to some of the points you're making about cross-border care.
Yeah.
If I may, one
No,
remark.
We can come to you in a minute, don't worry.
Thank you. No, I just want to state this very clear. it is so obvious that we can do so much together. This goes from rare diseases, it goes for cancer, it goes for any health area that we can think of. And we have to start, and we have to really make this happen in this mandate. But then I also want to make it completely clear that as much as I agree with you on the point of Mr. Vaheli's knowledge within the health area, it was completely a no-go, obviously, because this area of women's reproductive rights is health. And we cannot have a person with such anti-abortion views as he demonstrated standing up for us, talking on our behalf. This is the problem. So we have to think carefully about that part of his portfolio, then I can't say it more clearly. And in his answers, in his answers back to us, in the third line, he goes, this goes for every human being, including women. Yeah. Sorry.
We have
that
a problem, yeah.
Has to be done all over.
Thank you. Did you want to respond to some of the comments there?
One remark speaking about small countries and big countries in health, and of course keeping in mind human rights. I can tell you now we should understand. In EU, I see two types of countries: small countries and countries who do not understand that they are small. They do not understand that they are small. And when Letta proposed to think about single market, yes, about in health, you read Letta report. He is right to understand now. It's time to understand. What doesn't matter what we can touch, speaking about possibilities to apply human rights in all 27 member states, or to apply also possibilities to use big health data space for only 450 million people. In China, you have 1.8 billion people. And I see now we need to change paradigm. We need to think once again. EU is very small one globally, and health is very big one issue. And we need to overcome those situations, especially keeping in mind that health is human right. It should be applied in all 27 member states on equal basis.
MEP Martins, I want to come to you. Obviously, you worked, as we said, in Portugal before, and some of the, I kind of wanted to respond to some of the points that MEP Sokol made about opportunities to work better together. I just wondered, as someone who works at a national level, do you see areas where countries could be working better together on the health field, and anything that the Parliament could be doing to kind of help that?
Yeah, I do believe that we can do a lot at the European level, and not changing what are national competences and European competences. I think we don't need to change that to realize that there's some things that we can do at a European level. Of course, everything that has, diseases don't know borders. I've listened to some MEPs in SANT committee saying that they wanted to stop diseases with borders. Well, they are wrong. They are not going to be able to do it. So, of course, we need to articulate at the European level. And, of course, there are lots of issues that are related to industry that either we articulate at the European level or will not be able to defend anyone's health. When we talk about safety of patients, for instance, and the pharmaceutical, we need European regulation and we need European articulation. And even more so, when we talk about antibiotics, for instance, this is not only a problem of people taking too much antibiotics, this is a problem of farming, this is a problem of what we eat, of animals. So, of course, this has to be tackled in a European framework. But I wanted to add something. Let's be careful of what we think is ideological and we can work on what we think is not ideological. I do believe that everything is ideological. And women's rights are, yes, a choice, of course. And either you are on one side or the other. But isn't it the same when you believe that vaccines are something that you should listen to science? Because I listen in the Parliament every day to people that believe that science is lying to them and they don't want vaccines. Are we going to say, 2 years from now, oh, that is too ideological, let's not talk about vaccines? I hope not. And so I hope that things that, we core values that I thought we could agree upon, like science-based approaches, and women's rights, human rights, could be, I don't know, something to build upon, not to say it's ideological. And just to say something about the hearings and the Israeli competences, let me say something. I do believe that DG Sant has a great staff. And they've done very good work. But what I've listened to this candidate to commissioner is that he's not only he doesn't understand women's rights are human rights, and we do not have health policy and public health policy without women's rights and human rights. Sorry, but he not once, he says that he has a goal that is some kind of public health indicator or animal welfare indicator, because that is also in his portfolio. Not once. It's always about competitiveness. It's always about industry. He never talks about people, and that worries me a lot.
Health, as we mentioned at the top, is competing with lots of other areas, not just for attention, but also for spending, which you referred to. And one really obvious example of that is the cut to the EU for Health budget, which is this massive new stream of post-pandemic funding, which saw 1 billion shaved off of it earlier this year to redeploy to Ukraine. And the kind of future of that, too, is also a little bit up in the air. So I'm just wondering, maybe a question to each of you, shortly, is where will you be pushing for the EU institutions to be funneling their health spending over the next few years? Where do you think it would be, most valuable? I'll come to you first, Stine Bosse.
I listened to quite a lot of the hearings, and obviously not everyone, but Serafin from Poland, who is going to be in charge of the MFF, I listened to very carefully, also as a member of the Budget Committee. And what I found very good, and what is exactly what you're also alluding at, is one sentence where he said, there are so many areas within the European Union where we can do more and better and to less cost together. This is good news for those of us who really think that there is so much more we can do together in cross-border health areas. And if he stands by his words, then he is also the one that we can lean upon to say, let's invest. This is investing in the common areas for the European Union where we can work together. We're not changing competences or anything like that, but we're building motorways. We're building possibilities to work closer together. And here I think we can really try and depend on him keeping his words. And of course, we have to showcase that this is one of the areas where he should obviously start.
Okay. MEP Andriukaitis, where would you kind of suggest funneling that money into if it's, competing with other areas?
But frankly speaking, continuing about budgetary composition, of course, generally, EU budget is a very small one compared to all 27 member states. 1% of GDP is so old. It was done in 1992, until now is the same. And we are facing a lot of challenges, and now we are speaking about possibilities where we can find our additional, financial flows, keeping in mind own resources. Because no one country can accept issue to raise taxation, but own resources. And 1% is a ridiculous one. And of course, keeping in mind EU for Health program is also so small. Now 5.3 billion in this period. But when we are speaking about possibilities to go forward, to expand our understanding about second building blocks of the European Health Union, what do we need? We need financial instruments, financial means. It means that we need to think about possibility of much more biggest EU for Health budget to the next MFF. And here we can ask new commissioner also to keep eyes, because it's for me, it's absolutely crystal clear. With today's budget, we have no chance to build a genuine European health union as such, supporting member states on the ground to help a lot of challenges on the ground. And we need to speak about our possibility to expand our own resources, to collect much more money, and to collect our efforts to do much more, because health should be as an aim of the European Union in the next, in the future. Otherwise, people do not, people can disappoint with EU project as such.
MEP Sokol, where would you suggest kind of funneling this money, or where could it be most beneficial?
Yeah, first, I think that what we have in the budget reflects our political priorities. So one thing is to speak, blah, 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 nice phrases, etc. But then when you see the budget, you see what the politicians actually want. And as I said, this reduction of EU for health budget was definitely not a good sign, not a step in a good direction. What is important, however, is that it's still 10 times bigger than the previous health budget that we had before 2019. So it is a step forward when compared to that, but definitely in terms of trend that we have now, it's not very encouraging. What is also important, EU for Health program is not the only budgetary source which we have for health in EU budget. Actually, the biggest source is cohesion policy. And the goal of cohesion policy is to equalize chances, to equalize infrastructure, also working conditions for health workforce, etc. I think that we should also focus on that to a very large extent. Interestingly enough, in the hearing of Varhelyi, I was the one who was the first one to actually mention the question of equal access, which is strange coming from the EPP. You would expect that maybe from somebody who is more to the left of us. But I think equality, we cannot speak about European Health Union and really European social citizenship if we have a situation that in some countries, like in some Baltic countries, you have access to 3 innovative medicines which have been approved in the last 3 years, while in some big member states, or the biggest member states, you have access to 46 of them. So these are the problems that we have to solve. I think instead of trying to impose somebody's views on some divisive issues. So I think in that sense we can really do a lot. We will have to fight to strengthen the EU for health budget. Also to have a stronger role for health in cohesion policy, investing into infrastructure, especially in for instance rural areas, so areas underprivileged areas, islands, etc. In working conditions in general into workforce. European reference networks, I think it's a very good story. I think they can do much more in terms of also facilitating cross-border access. So this is also one thing which I think is very, very, very important. I personally propose, so this is my personal position, I'm not speaking on behalf of my group, but my personal position was in the previous MFF negotiations to actually create some kind of additional EU funding for cross-border health, so that those member states who have to pay for many treatments abroad do not run into financial problems because of this, because this is one of the reasons why they're reluctant to authorize treatments abroad. So I think EU can also help there to equalize at least the expenses there, and also in general to see what we can do about centers of excellence, because it is not rational, especially for rare diseases, that you have 3 centers of excellence in 3 countries which are 50 kilometers one from the other. No. So why not have one center of excellence, organize pathways to send patients abroad, and then we'll have much more rational healthcare systems and much better treatment for our patients. So I think on the EU level we can really do a lot in terms of actually having common EU policy, equalizing quality of healthcare, standards of healthcare, but not by top-down approach, imposing something that member states don't want, but actually helping them, providing them financial incentives, providing them funding, and actually I think that in that case we can really do much more than we have done up until now.
How do you respond to that, MEP Martins? Are there kind of specific financial instruments you'd like to see, or areas that you'd like to focus on when it comes to financing?
Okay, so I'll start by doing something weird, that is agreeing with the EPP. No, but agreeing, saying that, of course, if you don't put money in health and public health, you may say that it's important, but then it isn't. And if it's the first place that can be cut, then it isn't. But of course, we have all of other financial instruments too that have an importance in healthcare. And maybe I will talk about something else that I think is really important. I believe that we are all worried about what is happening with the national healthcare systems and the crisis in the workforce, in health workforce. So this is really a problem. What about when we start discussing the European semester? What are we going to say to the countries about their ability to invest in their healthcare services and the ability to pay better wages and to have better careers for the workforce in healthcare? So I believe that how much importance we give to health, also the European Union, will also be a debate on the European semester. Maybe it's not Sant that does that debate, but I think that that is really a very, very important debate, because either the member states can invest in their national healthcare systems and can invest in the workforces of that healthcare systems, or we have a really, really even bigger problem than we have already. And then all that we are saying is really very well intended, but absolutely empty.
Yeah,
just before, I think we're going to come to audience questions shortly, so I just want to come to one final question to you, MEP Sokol, which is about possibly the biggest or maybe most high-profile file that the EU institutions will have to grapple with over the next 5 years, which is the pharmaceutical legislation. Obviously, we know that the Parliament already has its position agreed. The Council is still in the process of agreeing that. But since the EU election, obviously, we've seen a new rapporteur for the EPP. And I'm just wondering, to what extent do you see national positions being a key factor in this, even at a parliament level? Like, do you see the change in rapporteur from a Danish one to a Spanish one having any impact on the parliament's position, just obviously because it is from your group?
Just to make things clear, I mean, the change of rapporteur was because the former rapporteur was not re-elected, so that was the reason. So there was no this was kind of a political decision to change the rapporteur to switch or something. But I think, so we had a lot of discussions in the parliament, but also within the EPP on this. And you know that here, I wouldn't say you have different positions fundamentally, but you have different angles. So in some countries you have more the question of access, more the question of availability of medicines is more of an issue. In some other countries, more the question of how to stimulate innovation. In some countries as well, the question of the generic industry, which is very important. So the idea was try to find a compromise between them. I was the shadow rapporteur on the regulation. For us, the idea was to protect the guaranteed baseline for the incentives, because we think it's important that companies know when they make business plans what is the legal framework, what they can count on, that they should not, because if their business plans depend on something which is outside of their control, for instance, within what time can a reimbursement decision be made, and we know that there are big differences across the member states, then we have a problem. So the idea was to protect some kind of a guaranteed baseline, that we provide some legal certainty. Also, it was important to protect the bowler exemption, which means that new generic medicines can be developed while the protection, market exclusivity is still ongoing, so that they can get to the market right away when the protection expires. So this was the idea of the compromise. Also on the AMR, I think on the question of stimulating investments into antibiotics, I think the compromise is also very good. We have a combination of push and pull incentives. It's voucher, but with conditions which make sure that actually medicines will be developed and get to the market, the new antibiotics, but with pull incentives as well. So I think it's a good compromise. On the Council, from what I'm hearing, I don't think that we will come to the compromise on the Council level in the first half of next year. I hope they prove me wrong. So this is something that will be discussed a lot. But I think what is really important is that we use this legislation to provide the framework to facilitate investments, to facilitate development of new medicines in Europe, to be less dependent on the others, but also it is important that we make sure that these medicines get to everybody in the EU at the same time, or as much as possible. This was one of the reasons why I imposed the obligation that companies have to provide, after request, a new medicine to national health insurance system within 1 year after the request. So this was the idea. This was the idea of the compromise. This is not a silver bullet. Pharma legislation cannot solve all the problems of access. I've been speaking for the last 5 years about the need to revise Transparency Directive on pricing and reimbursement. So it's a national competence, but procedure is regulated on EU level. We need more transparency. We need strong enforcement of the deadlines there. We also need better framework for cross-border healthcare for those treatments which cannot be available, for instance, in a small country where you need to send patients abroad. We have to help them. We have to provide the framework which will help patients go there. So I think in that sense, when we speak about all of these things, it's not just the pharma legislation, it's the cross-border healthcare directive, it's transparency directive, and of course in the future the EU Biotech Act, Critical Medicines Act, etc. So we have to look at all of this together. And just one last point to refer to what was previously said. Healthcare should be seen not as a cost, but as an investment. I think that's the crucial change of paradigm that we need. I think we can do that within the balanced budget, because I still think that having European semester and the need to have balanced budget, do not go into another Greek crisis, is important. But I think healthcare as an end in itself has gained importance in the country-specific recommendations, if you look at them, and I think that we can find a way to reconcile the need to see healthcare as an investment with the need to have a balanced budget, not to go into deficits and into financial problems again.
I think now we've just got a few minutes left, so I want to turn to our audience just for questions. Has anyone got any questions? Do I see any hands? I see, yes, one here. I think we have a roving mic and another, this guy, yeah, here, hello. I don't know how many mics we have, but they should be working their way towards you. Yes, thank you. So please do state your name and your organisation, and try and keep your question quite snappy too. And please stand up as well, thanks. Cheers. Sorry to put you on the spot.
I'm from 361 Public Affairs. It seems to me that the core restraints on both supply and demand for healthcare in the member states right now are demographics and the ageing society. Is it time to have an adult debate about immigration?
Who was that question to?
I can answer. I don't know what you're talking about exactly, how you were seeing the issue of migration in public health, but I see it in...
But can I have a
Yeah.
try? I mean, if your question is about, is the composition of, you know, the aging Europe, is that sustainable? Or do we need to think about steered migration? People from outside Europe that we really want, who are educated or who we can support the education of? The answer is obviously yes. We are not going to be able to live through the next 20, 30, whatever years if we do not think carefully about, especially in the healthcare area, do we need people, doctors, nurses, but also sort of primary health educated people to support us? For me, it's an obvious situation, but that is not like an overall migration debate. It's steered migration, and it's working together with third countries, also supporting their development of educated healthcare people in their own countries.
I just wanted to add that I agree with this, but the problem is Europe cannot be having some extractivist policy of taking workforce from third countries.
No, exactly.
And that is a problem that we have. We have third countries that are forming workers that cannot pay proper wages to that workers, and they are coming to Europe. And so we need to have a balance, because we cannot do this, we cannot be stealing workers from one country from another, and live in countries without the workforce.
In Europe,
so we need to have solidarity. We need migration, of course, but we need to have solidarity in forming the workers all across the globe and in paying them.
I think you wanted to respond
Can I
briefly
add
to that.
one issue? Please don't forget WHO code on possibilities to use healthcare workforce from third countries. We need to respect WHO rules and to respect all around the globe, because it is, when we are speaking about migration, we can keep in mind that a lot of challenges are in those countries from whom they are migrating. Please keep in mind we need to develop our own capacities. We have a lot of capacities to develop our healthcare workforce. And of course, please don't be egoistic like today. Some countries do not solving problems on recruiting healthcare workforce from third countries, from Eastern and Central European countries to Western countries. We need to stop it. Now it's up to us to say ethical code, speaking about the healthcare workforce, should be respected, and WHO code should be respected.
I think we are running over time now, so I think that is unfortunately our only question. I want to thank all of our speakers very much for joining us, and I think we have a coffee break taking place until 11:15. After that, we'll resume with a panel discussion on EU's healthcare systems. Thank you very much. Cheers.